Nice.
Okay,
So let me go live here. Checking connection. Let's go. Facebook. Good morning, everyone. We're getting all ready for our live Q&A with you guys this morning. So I hope everyone's doing well. Okay. I think we are all good. Good morning, Facebook. Good morning, Instagram. Let's see. Okay. Val, how are you doing today?
I'm doing well. Just got back from a vacation, so getting back into reality.
Nice. How was your trip?
It was very nice.
Nice. It was beautiful. Your pictures were beautiful.
Thank
You
you.
went to Miami, right?
Correct. Yeah.
That's cool. All right, awesome. Any let's see, any questions on your end? Like from the stuff we've been preparing and posts that we're putting out and videos we're shooting and things like that. Anything?
I have one of the Q&A question that I added in from my end that I'm going to ask.
Oh, cool.
again. I'm going to add it.
Nice. Awesome. That sounds great. So, oh, and then we do have a question that we got regarding babies, right? That we asked our expert, Dr. Christine. So we'll answer that on her behalf here. All right, cool. So I guess let's just jump into it and get going.
Cool. So our first question is, what services do you offer?
Okay, so we're a physical therapy office, so we strictly offer physical therapy. And that encompasses a bunch of things. I would say if you ask 10 people, ask them to describe what physical therapy is, maybe a few of them would really know, and only after either seeing a family member get it or a friend or getting it themselves or having had physical therapy themselves. So I think if I go back to my early days in high school and when I had this interest in something called sports medicine, physical therapy, I just assumed physical therapy was what you see in like a downstairs room of a hospital setting where they have a whirlpool bath, parallel bars that you do, walking rehab or gait training with, a few beds or plinths, the tables that we use. And that's pretty much it. I didn't know it was so much more. So I'm proud to be part of this profession and to be a PT. But what makes up what we do is really comes down to our assessment in when we evaluate someone. So if we're good at assessing and finding the dysfunctions and what the issues are that sometimes lead to a sort of joint pain, then we ultimately are successful in treating it. And there's some cases where people, for whatever reasons don't get better. However, majority of people with orthopedic musculoskeletal conditions do get better. So let me see. Did I answer that? Not really. I always go around and okay. So what services do we provide? We provide physical therapy, which can entail us using our hands to do manual therapy, to stretch joints, limber up muscle tightnesses, do something I guess people recognize it more as chiropractic care type of joint mobilizations, um, or manipulations. Um, what else? And then the other gamut of it is, prescribing the right exercises, and teaching our patients how to move better, and then ultimately how to function better, by putting all these pieces together. And sometimes we use modalities, but that would be the main thing that we do as part of our physical therapy.
Very interesting. Um, and then the next person asked, is kind of similar to the first question. Is
Okay.
this just exercise or how would I be treated?
Oh, good question. So I feel like we get this on the phone a lot when people call in as new patients. What do you guys do? Or is it just this? Or it's a combination of exercise, manual therapy, which I just described before. I can always go more deeper into what manual therapy is, which I love, but uh, and then the other component of it that I think is good for people to know is the assessment part. Um, we like go through extensive academic curriculum to learn about how to assess someone's, how to sorry, to learn how people move normally, and then how to be able to assess for dysfunction when people don't move normally or your joints don't move normally. So I think that's the one big component of it that we don't talk about enough as PTs. Um, Overall, we're too humble, like there's a big impact we can bring to, say, someone who's suffering with a said diagnosis. But I think that's where we excel, very much so with musculoskeletal conditions and orthopedic problems in our assessment, being able to say, hey, this is what the root cause is. Instead of just saying, oh, okay, this is the diagnosis the doctor informed me about, so this is how I'm going to treat it. If anything, we sort of take what we know about a certain diagnosis, throw it out the window, and then we look at the person as an individual, and we look and see where their dysfunctions are, and we really just piece it together, and we treat the dysfunction, and patients get better. So anything I missed there, Val, or did I, if I made it any confusing at all, just let me know.
No, I think that you answered it well. I think like what I want to know is when you prescribe exercises for a patient to do at home, is that something that they need to do those in order for the therapy that they do in the clinic to be effective for them? Or
Absolutely. I feel like that's another area where we sometimes don't do a good job. I think sometimes that home exercise prescription part is rushed, so we don't place as much emphasis on it. You do need to, like, if you think of people who go to the gym and they work out, right, and they lift weights and they have certain goals in mind. They want to become more muscular, they want to become stronger, they want their body to be more efficient with certain movements. They put in the work, like, and that's one thing where we try to educate our patients, like, you have to put in the work for your body to get stronger. And there's usually always a weakness component somewhere that leads to an injury. And I'm not talking about anything traumatic. Like if you're playing sports and you get knocked on the field and you have a trauma, that's a different injury. I'm talking more about those repetitive strain injuries, or those micro traumas, which it's kind of like you sit in bad posture for so many days and so many hours. That's all little stressors that add up to become a big stress for your spinal column, or your neck, or your shoulder area. So those injuries where it slowly develops, I'm just trying to think, where the heck did I just leave off about the home exercise prescription? That's a huge component of it. So they have to put in the work for their body to be able to get stronger. And if that's not done, there's less of the body's ability to almost learn, say, a new movement, and then for the muscles to develop and get stronger with that new movement. So that's a huge part of what we do. We put a lot of emphasis on it. And I know sometimes it's, I think just due to lack of time, it's rushed. So I always have to remember, like, to go back to making sure I teach it. And then I sort of ask the patient to show me how to do it. So it's almost like I quiz them. Okay, what did I just show you? How do you do it? And then I give them any cueing that's needed after I watch them perform, say, either a movement or a specific exercise or whatever. So great question, Val.
Makes sense. So this person is asking, how is physical therapy better than exercises I do at home that I found on YouTube?
One key element that I mentioned before is nobody is assessing to see what's wrong with you. So if you Google or you go on YouTube and you look up, for example, let's do quad strengthening, right? Or how to get my legs stronger. It's for the general population. It's not specific to you. So, I mean, I guess it just depends on if you're okay with that. In some cases, I hope there's no harm that comes from doing YouTube exercises. I probably could be proven wrong. Or maybe there are, I don't know. We've never polled anyone, but yeah, it's not going to be specific to you. So that if you're sort of okay with that, then that's good. It's almost like, what was it, like 20 years ago? I think gyms used to, they started this quick little circuit. They put a bunch of Cybex machines and like in a small room, and you could kind of go and do a quick 20-minute workout. And I think they sold it based on the efficiency of it, like, burn calories in 20 minutes and, or hit all your, muscle groups in 20 minutes. And you would just kind of go through each of the Cybex machines in a circuit. And so is that beneficial to you? Sure. You're exercising, you're working all your muscle groups, but is it focusing on, say, a goal that you have or specific movement that you want to become stronger in? Like if you think of someone elderly, right? They should really be able to, if they were to, say, stumble to the ground, God forbid, or fall, they should be able to lift themselves up off the floor, and then usually they'll go into like a half kneeling position. One knee is bent, one leg is up, and then use like furniture and help to lift themselves up. So that would be an example of, say, a movement that you want to be able to complete and have the strength to complete. So I guess it really depends on the person's goals. So if you're okay with exercise prescription, that's general, right? Then I guess YouTube videos are okay. However, I will say that do your due diligence in making sure the professional or the person who's prescribing this is a professional trained in prescribing exercise. Obviously, it's a no-brainer, but there's so much info out there. So just do a little research online and see who you subscribe to, and if they have the training to back what they say.
Okay. How long are the appointments?
About an hour and 15 minutes with us.
Okay.
Yeah. They could be shorter. Don't tend to be that much longer than that. But
so it's just like for generally everyone, it doesn't really depend on the type of.
It does depend, but just kind of it's just to give a one answer to that question. Yeah, about an hour and 15 minutes. If someone comes in for, say, an acute problem, a new injury, they can't really move well, every turn or twist is painful, we're not doing much with them except trying to relieve the pain. And so those sessions tend to be much shorter. So, and I don't mean to say we don't do anything. I mean, as far as exercise. So
Right.
we're not going to just throw 20 exercises at them. We're going to probably do a few. We want to cue certain important stabilization muscles, most likely, um, and do things that lessen the pain. So maybe more of us using manual therapy on them, um, using some modalities if needed, and then less exercise. So the session tends to be shorter.
Okay. How many times am I going to need to come in?
That really depends on your condition,
Mhm.
uh, what what the condition is, where along the spectrum of an injury it is. Is it a new injury? Is it like subacute? Is it chronic? And depends also, unfortunately, on how much your insurance will cover, like how many visits. So unfortunately, we have to use that as a factor. Ideally, we wouldn't. We would just give our professional advice on, okay, I'd like to see you 3 times a week, um, or 2 times a week. It's usually in the range of 2 to 3, though.
Mhm. Okay. The next person says, my husband is 45 years old and has been diagnosed with Achilles tendonitis. Can this condition be treated with physical therapy?
Oh, yes, absolutely. I would say definitely we treat it all the time. Um, Anything relating to muscle, bone, tendon, ligaments, joints, that's our bread and butter. So that's considered orthopedic uh, injuries or in orthopedic care. Um, so yes, any tendonitis that develops is something we absolutely treat. Most likely, there's a different root cause to why the Achilles tendonitis developed. So after getting that tendon to feel better, lessening the pain, improving just the general mobility and walking ability of this person, we'll look to see, hey, what overloaded this tendon and why did it lead to a tendonitis problem? So absolutely, yes.
Okay. Next one says, my brother has shin splints causing him a lot of pain. Can physical therapy help?
Yes. Very similar to the previous question. Shin splints tends to result from something not working efficiently in the body. And usually people develop this symptom. I call it a symptom because it's well, sorry, I want to call it a symptom, but people usually get this type of injury or pain from longer duration activity, like usually a walk or run. And so there's some weak link in our biomechanics that's leading to an overuse of some of your lower leg muscles. Like think of the muscles around your shin. So they're overworking and they're getting irritated and they're developing like an itis, which is like an inflammation. So and then that could lead to other problems as well. But was a question, can physical therapy help? Was that
Yeah, yeah.
okay? Yes. So physical therapy can definitely help. We'll, of course, treat the injury and then look for the root cause of why the shin muscles became overused and irritated.
Okay. This next one says, I slipped and fell in the bathroom, causing a fracture in my leg. I am a typically healthy and active woman. My
Okay.
cast will be removed next week. Do I need physical therapy?
You'll have to check with your doctor. So once you go and get the cast removed, your doctor will give you, the next set of instructions of what you need. But most likely, yes. So when you're casted, right? They were casted.
Mhm.
Okay.
Yeah.
So anything in and around the area of the cast tends to atrophy, right? Because you're not moving it. So there's a disuse atrophy there. And so that will need to be rebuilt and strengthened. So physical therapy is definitely indicated. And as long as the bone has healed and things are stable in and around that fracture, yes, your doctor will most likely send you for PT.
Okay, makes sense. My grandmother was diagnosed with Parkinson's a month ago, and I'm trying to help my mom suggest some therapies for her to help gain her strength and keep her active. Can occupation medicine help treat Parkinson's alongside her medication? She's currently taking levodopa.
Okay. So I think the person asking the questions asking about occupational therapy, maybe, right? Or occupation medicine.
She
But
said occupation medicine.
okay, I'm gonna guess they mean occupational therapy. And yes, it can be very beneficial. Of course, we do PT, so I don't know enough about OT or occupational therapy and exactly what they would do at this stage of, say, the the Parkinson's. Um, but yes, I would definitely speak to your grandma's neurologist
Mhm.
and come up with a plan. So hopefully the neurologist and the internal medicine doctors are communicating well on her case. There are a lot of different exercise programs and therapies available that will be beneficial for your grandma.
Okay. I was diagnosed with a medical condition called plantar fasciitis. If I'm
Okay.
pronouncing it right. I have swelling in my feet in spite of having anti-inflammatory medicines. What should I do?
Okay. So this is a condition in which the fascia on the bottom of our feet runs from your heel down to your metatarsal bones. Um, it becomes irritated, and sometimes it's over time, it's gotten a little bit more tight um, because of another biomechanical faultiness in the lower leg, in the foot, maybe even hip weakness up higher, right? So your hip, um, so if your hip is weak, it's not going to allow certain stabilization lower down your kinetic chain. So if you think of, what was it? What was a song? Your hip is connected, your hip bone's connected to your knee bone and your thigh bone, or your thigh bone's connected, whatever. So you just follow that song down to your ankle or your foot. And so the plantar fascia, when it gets irritated, it becomes plantar fasciitis. So it hurts to take that first step in the morning. It hurts to walk. People will tend to limp when it's acute or subacute. And it just needs to be similar to the question about Achilles tendonitis and shin splints. Of course, we would initially in physical therapy do what we can to reduce the pain. And if there is any inflammation, reduce the inflammation, get that fascia to be a little less irritated. And then really assess to see, hey, what was the root cause of it? We would make sure to mobilize the bones in the foot. There's many of them. I think Val's going to be quizzing Instagram soon about how many bones do we have in our feet.
Mhm.
And so we would make sure to see if there's what caused it. I feel like there's and as we treat each patient with this condition, we learn something new. But I always feel like there an argument could be made to say, hey, is it an issue in the foot? Like, is it because I have flat feet? Or is it an issue up higher? Like, um, uh, I tend to see more so of it's a secondary result of a more primary problem, tightness in our calf muscles, which forces the foot to have to pronate or even evert some bit more to be able to allow us to walk. And so that over time overuses that fascia and strains it, and it leads to a plantar fasciitis problem. So that's something I wouldn't hold off or put off getting PT for it. Just reach out to a local PT or you can always give us a call and we can do a consult with you over the phone.
Okay. So these types of not symptoms, but like that result from a bigger issue, do you treat the root cause first, or do you first treat the like inflammation or the result of that?
For the most part, we get that tissue that's symptomatic, like painful. We treat that first, because knowing that, like, say, if I find the root cause to be, say, something up higher, even in the pelvic area or the pelvis itself,
Mhm.
I'd rather lessen the pain at the foot, or say the heel, right, or the arch first, because I know what I might prescribe for the root cause will need a non-painful ability to move.
Okay.
So I hope that makes sense. So
It does. It does.
I want to make sure that that person, as I treat the root cause, isn't like just suffering and pain with, heel pain. So I always want to take away and lessen the whatever is acutely hurt. So if it's the heel, right? If there's a lot of tenderness, if there's a lot of soreness, if there's local swelling, or whatever, just tightnesses in and around the ankle, I'll want to treat that first, make that person feel better. And that ties into you building a trust with your patient as well. I think when you can make them feel better, and
Mhm.
especially initially on, they begin to trust you, because listen, there's so many different um, uh, experts out there, right? Or there's so many different doctors you can see, or types of doctors you can see. So I always know in the back of my head that, hey, these people or this person, say, with heel pain, maybe I'm like the fourth person they're seeing for this problem, right? So they're retelling their story. So I do need to somehow build a trust with them. And so if I can make them feel better even a little bit in one session, that definitely is my goal, because I know it's going to help to build their trust with me, or in my care. And then once they feel better and can walk with less of a limp, or they can walk more normally, that definitely helps to that gives me an advantage over the other exercises I might prescribe to treat the root cause. So
It makes sense. So this one's a little long. I'm gonna try to read it.
oh, okay.
It says, "Hi, I'm overweight, 49-year-old lady who had the damaged ankle from a previous motorbike versus car injury. 2 years ago, I hurt my Achilles tendon walking on uneven ground, where now it snaps every 5 to 10 steps with searing pain only to snap again.
Hmm.
It can be heard very audibly, the snaps. The only treatment I've received is a cortisone shot, which didn't really do anything to help. I find it hard to mobilize stairs. I use the walls of the house to lean on to get around my home after being very active. Even though I was a larger person, I now struggle to take more than 500 to 1,000 steps per day."
So was the question, can PT help, or how, or what should I do? I'm sorry.
Um, I don't I think that she wanted to know like if there was anything else that could help other than the cortisone shot that she took that didn't help.
Okay. So I'm not sure, because I know she said damaged ankle, right? So was there a fracture? Was it surgically repaired? Are there pins, and was it like stabilized via some metal, I'd want to know that stuff, because that is changes a lot of things as far as, say, mobility after the surgery. Or was it more soft tissue injuries? It's hard to say. So but listening to what she's not able to do and what she has difficulty doing, it definitely sounds like she needs a good assessment. Like, a musculoskeletal assessment, a good postural assessment. And I don't mean looking at her spine or only looking at her spine, but all the way down her kinetic chain down to her feet. And she would benefit from having someone like myself or our office, do a full assessment on her, watch her move, run her through some of our own tests, and then to see what we find, and then we'll at that point be able to let her know if we're able to help her. But of course, yes, a cortisone shot will reduce inflammation, but it doesn't cure any problems beyond that. Now, if there was a disease where people just from time to time had inflammation and it was just that, then yes, it would cure it. But usually the inflammation is a result of something, right? So the cortisone injections could be helpful to take away that like raw feeling of an injury or an acute feeling of an injury. But then it's funny, this ties into the first question. You have to put in the work. You have to figure out what's causing this inflammation or this irritation at one of your soft tissues, whether it's a tendon, whether it's the muscle, whether it's even the joint, right? And then treat it and then put in the work, where a lot of it is, where some of it is the work that we do on you, but then also the exercises we prescribe. And then that person has to put in their work and get themselves stronger. But so I would, if you came in or you called and we did a consult on the phone and you said, my ankle is really bothering me, and these are things I cannot do. I have to use the walls for stability when I walk, or almost like a crutch, right? I would say, hey, get your butt in to my office and set up a time, and let's do an evaluation and see if this is something that we can help, or at the very least, let us do an assessment and be able to guide you in what you might need, even if it's not with us. So was
Okay.
that all that it was to the question? Just what should I do? Or
Yeah, that's, you answered it correctly.
okay.
The next one is, do you treat for scoliosis, and what does PT for it look like?
Okay, great question. We do get a lot of calls for scoliosis, and we do treat a good number of them. Let me just pull up. I believe this was one that Dr. Christine answered for us. Let me just pull up. So let me see. Okay, so she said in scoliosis, depending on the curvature, right? So if it's a C-shaped curvature, if it's an S-shaped curvature, if and which way the curve is, there are certain muscles that are weak and overstretch, and other muscles that become tight. So after doing an evaluation and an assessment, we'll determine which of those muscles, need what type of work, which ones need to be stretched, and then which ones we need to focus on strengthening. And then she also said that we will also focus on core strengthening and posture to try to stop the advancement of the curvature, and in some cases decrease the degree of the curvature in the spine.
Okay.
So let me see if I have anything to add to it. No, she pretty much, that was pretty much it. And then trying to think. Yeah, anything, do you have any follow-up questions to that answer?
I don't. I think it was clear, pretty
Okay,
clear.
all right, cool. Just making sure. I know when we start talking curvature and core, and sometimes I'm like, make sure it doesn't go. Yeah.
That was the last one. Are there any other ones that
I think there was just that one pediatric one. Let me just hold on one sec. Okay, so I think the question was Do you treat torticollis?
Mhm.
And what does PT for it look like? Okay. So Dr. Christine is the expert in treating it. So she said that our torticollis treatment looks different for infants depending on how many months old they are and what age-related milestones they've reached and have yet to reach. When you look at treatment of torticollis, it looks a lot like just playing with the baby, but everything that is done has a specific reason for it. The PT, the physical therapist, will stretch the tight muscles in the child's neck, either by carrying them or while they are lying down on their back. Also, toy tracking to the side that the child has difficulty looking towards can be done on the child's back, on their stomach, in sitting, standing, and then depending on the age of the child. And then tummy time is a big portion of our treatment as well, working to strengthen the child's neck and back muscles and to help facilitate milestones like rolling and crawling. And treatment normally ranges from 40 to 60 minutes, depending on how much the child can tolerate. And then she also said, we also use techniques to help reach milestones that the child has not yet reached. So did that make sense? I feel like when I read it, I confused myself, but from what I've observed of her treatments, yes, she does use the toys to track,
Mhm.
to get them to, so if
Yeah.
they're tight on one way and they only look to the left, she's going to bring the toy to the right, so to encourage them to rotate right.
Right.
And then I've observed her a lot, like in the way she carries them. Like sometimes to me, it looks like she's just kind of calming them down or getting them to relax, but she's holding them in a specific way, like, and then trying to get them to, lift their head up. I'm not the expert, but this is just what I've seen and observed. But yeah, what have you observed? Because you've actually recorded some videos
Yeah.
that,
So I didn't realize that like the way she was holding the baby is actually like specific to like help them. Yeah, I didn't realize that. But um what else? The baby is always usually on their stomach, and now like I understand why. It's to like strengthen their muscles and like help them reach certain milestones. So I thought that was interesting too. And
yeah.
it does look a lot like playing, but like now from learning, I know that everything is done for a specific reason, like the toys and moving them around to like get them to move their neck.
Yeah, I know, it's amazing. Actually, it's really cool to watch her. She's a
Yeah,
natural at it. So,
definitely fun to watch.
um, let's see. So, do we have any questions?
I have a question that I wanted to add in.
Sure.
That I think that was all there was from everything else, from
Okay.
my understanding. So I wanted to know, what would treatments for headaches look like? Like someone who gets frequent headaches.
Sure. So you'd have to figure out, I mean, the cause of it, right? So I'm guessing by the time they reach us, unless like say a family member said, "Oh no, go, they helped with my headaches, go see them," they've had imaging done, right? An X-ray, MRI. And I'm not talking about like, oh my God, the worst headache ever in my life, because usually they'll do a CT scan of the brain and make sure there's nothing serious going on. Um, these are, repetitive headaches that come maybe once a week, twice a week, a few times a day. So if it's something that we can help with, because there's also migraines, right? And that's a different category of or headache types or that sort of thing. We usually treat cervicogenic headaches, so the root cause is in the cervical spine, and tension type headaches, which is just tension around maybe the muscles in the back. I wouldn't not count in the muscle we have here, so that could be a part of it, although it's one of our jaw muscles right here. But anyhow, And then just fascial tightness also in the head and the scalp, almost like if you grab your hair and you tug on it, like does your skin slide easily? That's like a quick way to sort of test it.
Mhm.
So we do treat this a lot. We do put this in a lot of our marketing materials so that people are aware that, hey, this is something that can be remedied by us. And so the treatment for it, number one, like any other, we do the assessment just to see what's restricted. Usually there's either muscle restrictions, muscle tightnesses, spasms here. We do a full assessment of the cervical spine, your thoracic spine, which is right behind where people think of their shoulders over here. And we look to see if mobility is good. Of course, we look at posture as well. And then we look to see beyond that, like how this developed or why this sort of developed, or what the ultimate root cause for it could be. I know stress as well, like if someone has a lot of stress, and then you compound that with more screen time, more eye strain tends to make your neck muscles more tense. um Say like a busy work schedule. So you add that all together, like stress, busy work schedule, maybe don't exercise, or get some, think of it as just being able to like take a walk, or just clear your mind, or just do something for yourself, right? So they don't get any of that. And I don't want to call it recreational, because I don't want to make it sound like it's a sport, but just general exercise for yourself. That's just for you, right? And so you add all these things into this box of all these things that can negatively impact you as a person. And it's easy to see how, say, a headache problem could develop. But anyway, I'm like digressing a lot. But your question was, can headaches be treated with PT? And if so, how, right?
Yeah, correct.
Okay. So I'll stay on topic. But yeah, so headaches can definitely be treated by PT. And treatment a lot of times involves mobilizing the cervical spine, thoracic spine, doing a lot of soft tissue work. So getting these muscles looser in the back. And then looking at the whole person, I always look at, like, first thing, of course, we speak to the person and we get an idea of what's going on with them. And then I look at their posture is the number one thing. I look at them, I see how they move, and that tells us a lot. And so my job is to improve all those little things that I see that are not working well. And that's how, just like any other condition, how a headache would be treated. It's just the pain is here, right? Sometimes it comes here. Sometimes it's behind your eye. So it's behind the orbit.
Mhm.
Sometimes there's some jaw tension and they might have another problem going on with the TMJ. So we look at all those things and we piece everything together, and then we work on, one or two at a time. So I always go to the cervical spine. That's the first area I go to. Could that be different for someone else with a headache? Yes, of course. It just depends on my assessment and what I find. But great question. PT can definitely help it, especially if it's neck related. I mean, we treat necks all the time. We mobilize them. Yeah, trying to think if there's any pearls of wisdom I can throw out, but no, I just talk in circles sometimes. And then you summarize it up for me. So
Thank you. That was clear. And like there are so many different causes of headache, so it's like
yeah.
hard to pinpoint like it's because of this,
Also,
that.
I
Yeah.
think I recently learned that people who get migraines, there's a certain shucks, I want to make sure I say this correctly. There's actually, I'll come back to that on the next one. I'm gonna make sure I don't misspeak and say the wrong thing. But it could also be like a lack of a certain, say, vitamin or
Yeah.
electrolyte even that can, lead to more migraines and having a migraine problem. So yeah.
Interesting.
So
Cool.
I have a question for you. Maybe you can answer this next time. So say I was curious that, okay, do I get enough magnesium in my body every day, right? How do I find that out? I'd have to use like an outside lab, of course, right? And there's a lot of them, but they are pretty pricey. I'm not saying it's not worth it, but they are pretty pricey. So how do we figure out like what's a good lab? Like if I wanted to know, am I deficient in certain nutrients in my body? How do I test for that? And without having to like, something, something more simple, like, I mean, I don't think you could swab your cheek. That's DNA, but how the heck can it be done, right? Would it be strips that maybe you pee on and then it tells you, or yeah, how come, maybe we can look into that and answer, because sometimes I feel like I'm very drawn to nutrition, you're very drawn to nutrition, so if that was a question we ever got, I wouldn't even know how to answer it. I wouldn't say, yeah, go to LabCorp, right? Because your doctor has to prescribe it, but also I don't know if they even test for things like that. But maybe
Yeah.
do you have any suggestions or?
It's actually a really good question because like I think I was thinking about this myself because I'm actually learning a lot about like different supplements right now in the program that I'm in, and actually like
Nice.
magnesium is like linked, like taking magnesium supplements is linked to like better mood, less headaches. What else? There's something else too. I'm not remembering what it is,
Like
but
magnesium is so underrated. It is so good for you. And sometimes I just tell people, patients, not people, I tell patients, it's your body's natural muscle relaxer, right? So, but of course, without knowing if it's deficient, you don't want to say, go take it, right?
yeah.
So maybe once you and I figure out how that could be done, we can say, hey, take this, pee on this strip, and then you'll know if you need it, I don't know if it's that easy, but
I'll definitely do some research about it. I'm very curious myself.
cool. Nice. So what else are you learning about? So you learned about magnesium, and then what other few supplements?
So I'm learning a lot about how like there are so many supplements out there, and like they're great if you know that you have a deficiency in something, but at the same time we have to realize that um a lot of these minerals and vitamins and all these things, they should come from the food that we're eating. Not we shouldn't just
Yeah.
rely on supplements. And
Yep.
like
Nice.
taking too many over time can lead to other issues. So it's very important to make sure that we're getting the proper nutrients from the food that we're eating.
Nice. So cool. So there's another question on top of the first question we'll have to answer next time. So how do we test for deficiencies? And then say we'll pick one electrolyte and then we'll talk about what foods they're high in, right? And then that could be the recommendation. So nice, cool. I love that stuff.
Me too.
All right, awesome. Oh, I think there was a question. It said
Yeah.
PT help with sinus pain and sinus headaches that radiate down to the jaw. That's a great question. I honestly don't know, but I will look into it. I believe yes, and I believe there are some expert PT clinicians out there that do a lot of work with TMJ that also do like mobilize the bones of your skull, I guess you could say, or your face, right? Your facial bones. And that could be helpful, but I'll have to do some research on that. I don't use any techniques, or I don't know about any, but that doesn't mean to say that there aren't. There probably are. So I'll do some research, and if it's okay, I'll answer that question next time.
Okay. I'll save it so that we have it for.
Okay.
Okay. Got it. Cool.
All right, awesome. Cool. So everyone have a great day. I thought Val was gonna do a conclusion, but I'll do
Oh,
it.
I can do
No, no, it's okay. All right, go ahead.
um I think we got some really good questions this time, and like I love being a part of these and being here and learning new things and
Nice.
asking follow-up questions.
Cool. It's awesome. And I kind of liked how we touched a little bit about what you're studying and learning about. Because you'll be the expert, soon enough where people can come to you and say, hey, I have these symptoms. What do you think? And then you would say, oh, okay. In my training, this is what I think. And then, and so on and so forth. So feel free if you think it's helpful, because we get questions about what should I eat for if I have a lot of pain and inflammation. We get those questions a lot in the clinic. So if we could tie this in a little bit of a nutrition component to this, that's also helpful. So feel free, maybe next time, Val, we'll, if you want to do a mini topic, like something almost like it was a question sent to you, right?
Right.
Sort of like how you just gave a quick synopsis on magnesium. Maybe we can talk about something else, next time, and what you're learning about it. So
That'd be really cool.
yeah,
I'll
definitely.
definitely think of something that we can tie into what we're talking about.
Okay. All right. Great. Well, everyone have a great Tuesday. Have a good rest of your week, and we'll see you guys soon.
See you guys soon.
Bye.
Bye.